I fell in love with West Texas, so I just got a map of West Texas out. And when I went to South Plains, I fell in love with West Texas. People were so nice. I pulled up at the bank and like I was writing a check for 20 bucks or something for pizza or something, and I'm holding my ID. I've only been there like 3 or 4 times before, and the lady's like, "Hey Wendell, how do you like school?" And I was looking at my ID and I was like, how the heck does she know who I am? And I was like, this is spooky. Well, because it's a small town, they know everybody. And I fell in love with that, you know. My dad was a doctor. I didn't know what else to do, really. I wasn't really paying attention. And then when it got to be, well, of course, I'll be a doctor like my dad. He was a radiologist, and he did mostly research and teaching, but he would moonlight and go out to small towns and read x-rays for them. And sometimes I would go with them, and I would get to see these small town doctors. And to me, that was exciting, because my dad is like, he would look at x-rays and tell them what was going on. But to me, like listening to their stories, well, I had a lady come in and she was in a car wreck and this happened and this or whatever, or she has this problem, I don't understand it, like, and then he's looking at the bones and looking at the x-rays and trying to help him learn, you know, say, I think this is what it is, and they would be, you know, they got along real well. But I was always like, I want to do that. I want to be the guy that's out there, you know, solving the problems, and not the guy that's reading the x-rays, really. So I always try to do that first, to use medicine first, or to use time or use other healing methods first, and then surgery last as if it's needed. Sometimes surgery makes a huge difference and helps them out a lot, but you should always try everything else first. Don't just go right to the knife, you know. And I think, you know, we have a very busy practice, and I think a lot of it has to know that my patients understand that I care about them, that their safety is first to me, and that they're, you know, I feel like they're part of my family, and that I want them and their family to do well. So, I mean, talk to your friends, and you should feel comfortable with your doctor, you know. You should feel like you can talk to him, you could tell him stuff. You should feel like he's trying to help you and he's doing his best to help you. And if you don't feel that way, then you should find a doctor that does. And any doctor who's jealous of you finding someone else, then they're not a very good doctor, I don't think. I think that, you know, the doctor who is really working hard to make his patients better, and that they feel and they trust him, and they know he's honest with them, that he's going to be busy. And we're very busy. We're blessed.